Hello, everybody, and welcome to the Virtual Book Club again. And today we are going to discuss the book An Unquiet Mind by Redfield Jamison. And I'm alone today. I don't have my wing woman because she is on vacation. So just bear with me. If you write anything in the chat, I'm probably going to miss it. So don't do that. Just talk to me directly. Anyway, and remember to mute yourselves when a person is talking. That way we don't have feedback and all that stuff, because, there might be a lot of people and then the feedback gets messy. And also just a reminder that, I encourage candor because that makes the discussions very meaningful for people. But if there's something that you want to share with the group, but you don't want recorded, then please let me know, and we can keep it until the end of the session, so that I can stop the recording and then we can talk about that. Okay. What else can I say? And remember that these meetings are recorded and shared to the rest of HTPA. So yeah, just be aware. All right, and let's see. I'm actually going to start this off with reading Diane's thoughts on this book. So I'm going to read this out to you from Diane. Just a few thoughts on An Unquiet Mind. If you could please share with the group for me. I think that this is a brave, intimate, personal account of her experience with manic depression and its effect on her personal and professional life. A gripping, well-written story that at times made me feel uncomfortable or almost a little queasy due to her ability to portray in such powerful terms the symptoms of the condition and the challenge she faces. Especially relevant for me is the description of the harrowing relationship with lithium treatment, probably the best description that I have ever read. I saw parallels with Molecules of Emotion in terms of two powerful, well-educated women in a male-dominated profession, each with challenges. I really enjoyed this book, very enlightening and engaging and informative. So that was Diane. So, how many of you finished reading the book? Okay, and all right. So who wants to talk about it next? Anyone? No?
I'll talk
Okay.
about it.
Okay, you can talk about it. All right, go ahead.
I thought it was so well written, and her description of the illness and the battle with on lithium, off lithium, was. I think I've never seen a better description of this. I had worked on a psych unit, psychiatric nursing, for 8 to 10 years, and I watched as people had ECT treatments for depression. And those days we did them right in a day room. It was not in the OR or anything, and you could see remarkable results from it. And I remember I could really relate to this because I remember caring for a woman who was on her high swing, and she had exhausted all of her credit cards. So as Kay described, going into her room and seeing bags and books and all these things she bought, and she didn't know why she bought them. It really brought back memories of this other woman struggling. She was buying everything off the internet. That was before QVC and those thank goodness, QVC and those kinds of shopping. But it just, it was so well written. And I'm trying to find where it was in here that uh, she said, and this thought came to me as I read this, is that not only for lithium, but I think for all people that end up with some sort of illness they didn't ask for, didn't want, and now your body has forsaken you and you're not in control of it. And on, I think it was page 97, she says, I longed for the days that I had known before madness and medication had insinuated their way into every aspect of my existence. It was, she just wanted to be whole and she didn't want to have to depend on this. And I think that could speak for many illnesses. You didn't ask for it, but here it is, and you're angry at it. But her successes, and I got it, as she mentions many times in her book, she was thankful for her family, thankful for the many friendships, the psychiatrists that she was involved with. Even, she talked about the suicide attempt. And she always had a little bit of underlying humor in it when she talked about the annual psychiatric conference that they'd go to. Inevitably, it was in May, which was the highest month of suicide. And I thought, there is some little innuendos of humor in there with all this tragedy. And but she, she rose to the top in spite of all of this, and is known as pretty much one of the best psychiatric therapists in the United States. I find it utterly amazing. I loved this book. I would recommend it to anyone. And I actually did recommend it to, and unbeknown to me, it was a patient I was treating in my private Healing Touch practice. And I was talking about reading this book and how wonderful it was. And she said to me that her sister was bipolar. And she said she would take the book out and read it and see if it was something her sister would, want to read. So, but I enjoyed it 100%.
Yes, yes, yes. Interesting about the month of May. I did not know that that is supposed to be the month with the highest number of suicides, because what I do know is that May is Mental Health Awareness Month. So it makes sense. It's like, oh, okay, I didn't know that. Although September is the Suicide Prevention Awareness Month. But anyway, yes, she is such a exquisite writer, exquisitely eloquent writer. It was such a pleasure to read the book. For me, it was so captivating and so well written that I read through it very quickly, and I couldn't put it down, and so vivid in its descriptions. And it's not just the way she describes it, but also her essence throughout the book, the way she makes the connections, the way she tells the story, the way she uses language. All of those things actually convey the beauty and the tragedy of the illness. It's really quite something. I to tell you the truth, I have not come across any female writers that are up to par with my two greatest writers of all, which is Ernest Hemingway and Patrick O'Brien. But I would say this lady really, her command of the language and her insight, her perceptiveness, really came close to those guys. I'm actually going to read her other books. Yes, Rosemary.
You know, at first I wasn't going to read the book. I thought, oh my goodness, I just don't need any more of this. I do not have the background in mental illness as much. I do work on a floor of a hospital 3 days a week, involved with all types, patients with ECT, um, depression, anxiety. But just like when we read the book with the girl, the autistic mind on the high spectrum, it just floored me over and over again that she was able to write and articulate as well as she was under the, I mean, does lithium make that big of a difference? She does say it works for her. But she also didn't go into the detail of the months and months of depression. So I find usually when people are suffering with this, it's very hard for them to even talk. Patients coming out of ECT sometimes they're very catatonic, and so it just I was really floored. Yes, I loved the book, and it was very informative for me. I think the whole series that we've been doing has been awesome because it's the type of patient that I work with. All of them that we have covered so far, and it's really helped me a lot. So I do. So I would be interested to what someone had to say about her ability to articulate this, and does lithium make that big a difference?
Thank you for your feedback. Yes. Would anybody else like to talk about this? I mean, I have lots of things to say, but I don't want to just, do a soliloquy. All right, go ahead, Mary.
Hi, I'm Mary, and I'm new to the group, and I actually joined HTPA too late to read the book. But so last night, and I have heard of the book, but I did listen to a talk that she'd given at a university, and it was about an hour. I don't know, but she did talk about this year of deep depression where she really was just drowning, and right before she did a pretty serious suicide attempt, she had seen her therapist, and in retrospect, the only thing that I can't remember if it was a woman or a man who was her therapist, but I just noted that she was very quiet that day. She seemed just kind of quiet that day. So that was the only clue that they had. I don't know if this was in the book or not, but about how severely, on the edge she was with it. But it really struck me that this downside was over a year's worth of time. And I don't remember what she said about if she was on her lithium or not, but but you can tell with her speaking voice, she does slur a little bit, and she talked about having to give up, that whole issue of it. And the other thing I just found helpful is that sometimes I go to are you familiar with the group NAMI, which is the National Association of Mental Illness? Sometimes I go to those meetings, the family support meetings, and this gave me a much sort of more specific idea of what bipolar disorder is, like the extremes of it. Whereas you have people in your life where you just kind of wonder, oh, are they bipolar? Well, not like this at all. This is not as they're moody. They're just not like, they don't have these intense ups and downs the way that she described it. So I thought it was really interesting. I was really grateful that I'd at least listened to the talk that she'd given. So, yeah.
Thank you, Mary. Yeah, I should probably take a look at that as well. I haven't had the chance, but what you said about that particular moment in the book where she talked about the period just before she attempted suicide, how she was quiet. She kept it from everybody else, even her psychiatrist. And her psychiatrist was very, very perceptive. And he, his notes on her, which she shared, were, very, very, very probing and very deep and very honest. But and that's interesting, though, that just before she actually attempted suicide, she was quiet. And that actually is a very good example of what happens. And I talked about this in the last session. What was it? Was it Molecules of Emotion, the previous one? Was that the book that we did? Okay, can't remember why this came up. Oh, it was about feelings. Yeah, it was about how we were talking in that session about the importance of expressing your feelings, not just positive feelings, but negative feelings as well. And at one point, myself and the person who was talking in the meeting talked about how I think I raised the incidents of how people are afraid when they come across somebody who is suicidal to engage that person in talking about it, because there's this myth that if you talk about suicide you're going to do it, but actually it's the other way around. If they're talking about it, they're not going to do it. If they're talking about it, they are still recoverable, really. The ones who don't talk about it, those are the ones who are successful suicides, as Kay put it in the book. So yeah, so in that instance, we have a very uh, great illustration again from her personal life, how that happened. So thank you for bringing that up. Actually, anybody else would like to share their thoughts? Yeah, go ahead, Ellen.
I was thinking about she had the interaction with two people. It was more towards the end of the book. One was when she was going to be seeking clinical privileges, I think tenure at the end, and she thought she needed to talk to her boss, it seemed like, and tell him, you know what I mean, this might be a stumbling block, and he said, yes, I know that, you know what I mean. It was like no big deal. He understood she was performing her job well. And then compared to there was another person who was a friend of hers, a fellow faculty, I think, and that he became very distraught and disappointed in her when she, divulged that to him. And I thought she was, very brave, and wanted to be honest and try to, take that relationship to a more deeper level, and how different their reactions, do you know what I mean, from each other really were. And just that, she's very brave woman, and I think it gives you much more chance, to have some glimpse and understanding of, this disease and how it impacts people. I remember as a newer nurse doing some supervision and working with, I was new to the agency, home health, and there was a nurse there who had was pregnant, and the boss had told me that she had stopped taking her lithium because of the pregnancy, and the gal was really quite quiet, you know what I mean. And then she wasn't there very long as she had her daughter, do you know what I mean. But then she came back, and then I got to see the real her, do you know what I mean, her more active self, and when she was feeling better. But I haven't had a lot of experience, with people, and this gives me much more idea of the challenges and appreciation for, the effort and the work to live each day. And then to share it, I think is really helpful.
Yes, indeed. Indeed. Very brave of her. It's not easy to be so candid. But anybody else would like to share? Oh, the two people you're talking about, I believe the second one, the one who was disappointed in her, he was called Mouse Heart. I don't know if that's a nickname or whether that's actually his name. But yeah, he was telling her how Oh, actually, here's a different one. This was a different, not Mouse Heart, but somebody else. Oh yeah, and the Mouse Heart thing was really, you could really feel how awful that situation was, because she was so close to him as a friend that she wanted to take him into her confidence, and instead he turns around and, shows his real colors, and then another thing was the doctor, a physician that was recommended to her, whom she saw. And that physician basically, told her that it was such a terrible disease that she must not even think about having children. So, and that makes, anyway, so yeah, so that's very interesting. And towards the end of the book, she does talk about, um, the ethics involved in, uh, the study of genes, right? And you know, all the medical stuff involved with that. And, it raises a lot of questions, like, what are you going to do? Are you going to, like, um, what do you call that? Weed out the genes that contribute to, bipolar? And then there's the how bipolar is connected greatly to levels of genius, and which has actually propelled humanity towards, discoveries and progress and all that. So what would be the impact of weeding out those genes, right? And if you did that, then, there'll be lots of other genes to weed out as well. Where does it stop, right? And yeah, so there you go. Anyway, so anybody else would like to share their thoughts on this? It's extremely enlightening book.
I had one comment to make on Ellen's attraction to the chapter with tenure, and it reminded me of the previous book we read, and where the professor comes in and congratulates her with a bottle of wine. That she became the head of the department. He said, "Welcome to the all men's club," and I thought, boy, that sounds familiar. As the last book we read, it was always in competition, not just for the position, but competition because of the gender. I just thought, wow, it was like the same generation, the same times, and but it was still brought forward in this book. Found that interesting.
What I also noticed, however, that in this book, in Kay's writing, she really didn't dwell very much on the gender issue, and how she was in a male dominated profession, and her being, a woman in the minority and all that and so forth. She really didn't dwell very much on that at all, in comparison to Candace Pert's book. So I found that very, very, very interesting. And so yeah, which it's rare. It's rare to have someone who obviously faced the same challenges, and they're from a similar time period and everything, and yet she didn't she that wasn't really a major focal point for her, for the story she was telling in this book. So
Yes, there was only one sentence about it,
yes.
and actually,
Mm-hmm.
but I thought that was interesting.
But just reading about it, you already get a sense of the enormity of the challenges she went through, and what an accomplishment that in spite of all that, she got to where she got. She really, I mean, it was absolutely not, there was no need for her to harp on that at all, because just following, the story with its very, very central premise of her medical condition, you really didn't need to think of anything else. You saw exactly what the struggle was, and you saw exactly how she surmounted it. Nonetheless, it's amazing story.
Yeah.
Well, and I even found, hi everybody, that there was a part where she was talking about her sister, and that her sister was disappointed in her because she was on the medicine. And her part read, "I could not afford to be near someone representing as she did the temptations residing in my unmedicated mind. The voice of upbringing that said one should be able to handle everything by oneself. The catnip allure of recapturing lost moods and ecstasies." And it was, you had talked about it a little bit earlier on the call, but just that relationship with, in some ways, being really enamored with who she was, and how lithium took some of that away, but yet it also kept her sane. I mean, I agree. She's so incredibly eloquent. I just have flags all over the book of things that she said that I said, oh my gosh, that's an incredible point. But it just, how pervasive is it in our society that people are just supposed to tough stuff out, and that you're finally on a medication that works, and then somebody disses you for it.
Yep, absolutely. That is a very, very good point. And that I really love that message in her book, the importance of treating the condition. She prefers to call the disease manic-depressive or manic depression rather than bipolar, because to her it captures the essence of the swings, the mood swings. You've got the mania and you've got the depression, right? And by calling it bipolar, you kind of remove that visual. And also, now for me, there are some things there. Okay, from the very maybe first couple of pages or so, she talks about madness, and she frequently brings up the word madness and being mad. And somehow for me, it really made me feel uncomfortable, right? On the other hand, when you see how her mania pushed so far beyond the really went off the rails, beyond what she could handle, then yeah, I mean, what else can you say? There's no polite way to call it. It is madness, when you lose control of yourself like that. And so now, in terms of the term for the disease, I kind of like bipolar, just because, well, kind of a nice word, bipolar. I like bears, and bipolar bear, but also because the word manic depressive sounds so harsh, But then that was her point: is that you've got to call it as it is, because that way people will take it seriously as a disease, and will remember that it's important to treat it, that you have to keep the seriousness of it, with the name. So I guess, even though I find it harsh, at the same time I understand. It's like, well, yeah, I guess you'd have to, given the fact that a lot of people who are diagnosed with it really, really have a hard time staying on the medication because they don't feel that they need it, you know? So And yes, as many people, several of you have pointed out, and Diane as well, her description of how she kept fighting against the medicine that actually helped her was very, very, it really captures the struggle. And that's why it is very, very, it was very important, that part in the book where she had to, remove herself from the influence of her sister. I mean, just how awful is that? Someone who is so close to you like that, who is, everything that she said. I mean, I can't say it any better than she did, all those words that Jean quoted from the book. It's just, yeah, exactly. And as healers, those of us in this field, I think you are probably well aware that there is this tendency to put medicine down, that you have to do all this alternative stuff to to treat this or that. And if you are dependent on a medication, then maybe you're not a good enough healer. Maybe you're not you know you're not as, yeah, that is a weakness. So it's not just a general myth in the in the general population, but I think it is also very, very particular in the healing community. That I'm telling you this, that I know people who should be on medication and who should have been on medication. And where does untreated depression or manic depression go? It does not end well. And, I mean, first of all, to lose your life over what other people think, that's one thing. But secondly, for society, for the community to go around and harbor these kinds of feelings, these myths, and propagate it, that's terrible. So yeah, I am definitely, I feel passionately about that. Anybody else would like to talk about this book?
The whole field was really new to me. I don't have the health background, but I loved it. It was so well written. I think the epilogue is just, she needs a great prize just for that epilogue. It's just stunning. I mean, if more people could just read that, I think they would understand. I guess I have more questions for y'all who have been or in the field. I looked up lithium and found out there's like 3 million people in America on lithium. And the book is over 25 years old. So I'm just wondering any updates on treatment for this since the book was written, besides lithium.
Does anybody have an answer to that question? I actually, that is a rabbit hole that I would like to pursue after reading this book. Yeah, I too wondered, just like you, Faye, has there been any progress in the treatment since then? I don't know, to tell you the truth. So that's something that I would research.
Just curious.
Yes, but I do find it very, very, wow, quite an interesting thing, because this book was written all those years ago, and she had to have 300 milligrams of lithium in her blood for it to work. And according to her, the therapeutic level of lithium was, as she put it, precariously close to the toxic level of lithium. Plus the side effects that she talks about, where it how it affects her, with the vomiting and with the slurred speech, the slowness of the mind, inability to read and things like that. That's huge, especially for someone who loves to read. Now, I don't know about the latest treatments for bipolar. If Diane was here, she might know a thing or two about it. But I do know about other kinds of treatments for other kinds of depressions. Like, for example, you've got all those things. I think she mentioned Prozac in there, but Prozac, from what I understand, is a really big hammer. And since then, there are gentler things like Zoloft, otherwise known as sertraline, and there was another one. There's like three main things. There's Prozac, there's Zoloft, and there's one other thing, but I can't think of it right now. But and I think the highest dosage would be like something like 200 milligrams is a therapeutic dose that is given for people with severe condition. I could be wrong because I am not a psychiatrist. So yeah, so that's very interesting. And let me see, anybody else want to talk about this book before I continue further?
I had one other thing, and not related to the medicine, but with how many times she kind of asks herself throughout the book, who am I? And she talks about being raised as a genteel Southern woman and that her exuberance made her not that. She talks about being a violent woman. At one point, she talks about trying to reconcile her notion of herself as a reasonably quiet-spoken and highly disciplined person, one at least generally sensitive to the moods and feelings of others, with an enraged, utterly insane, and abusive woman who lost access to all control or reason. And I just, we all ask, who am I? Frequently. And but boy, it made me realize when I'm asking who am I, I'm not trying to reconcile that kind of who am I. I just and then the who am I on medicine versus the who am I when I'm ill, and the who was I before and who will I be in the future. And it just it was really powerful for me to hear her talk about that.
Yes, thank you for sharing that. Anybody else want to talk about this? Because I do have some interesting things to talk about. I wrote down my thoughts. So anybody else want to talk about this? Katie, let's see who. I think it's only Katie that hasn't spoken, right? Everybody else has talked about this. Hi, Katie. Did you want to talk about the book?
No, I'm just listening.
Okay, that's not a problem. So let me go ahead and so these are my thoughts. It's going to be a soliloquy, I'm telling you. So just be prepared, okay? But I let you all speak already. But so I find that it took a lot of courage for her to write such a book, to educate and bring awareness to the disease, especially for someone in her profession. I mean, she's a psychiatrist, you know what I'm saying? And that's why she got into that profession. And, when you fast forward in the book to the time where she was talking with that her boss or whatever, revealing to him about her disease, if that's going to be a problem with her wanting to get tenure and all that stuff, and how he assured her that he knew about her problem and that she's doing well. And he said that if we had to, if all the doctors and psychiatrists had to be questioned because of their mental illness that they're struggling with, then, that would be like a lot of people in the field. So you got to wonder. I mean, a lot of us got into healing work because we experienced healing, right? So there are many people who get into psychiatry because of a family member or someone close to them who was struggling with the disease. Now, this is the first time I've actually read of someone who was suffering from the disease itself, who got into the profession. So that's really quite amazing. And so, yeah, and I wrote here that because of her personal experience, she has given the field so much. She has done much to increase the awareness and care. So that's quite a profound impact because of the fact that she struggles with the disease, the very disease that she's trying to treat, And I just like several of you have mentioned already, I just can't believe how, even while she was dealing with all that she went through, she accomplished so much, especially that I think it was an outpatient teaching clinic, and the textbook on the disease, etc. I mean, just her list of accomplishments in regard to the field is amazing, amazing. And that just, I think that illustrates the the beauty of the mania and how difficult it is for those with the disease to give it up, or to give up the intensity of it because of it becoming so out of control that it becomes a disease. Because when it's not out of control, it's extremely, it's genius, it's productive. I mean, look at all the things that she accomplished, that even when she had years of catatonic depression, she could make it up with the years of mania. You see what I'm saying? And that even if it may have been dulled by lithium, it's still, compared to the regular person who does not have that temperament or those genes, she still accomplished a lot, didn't she? You see, it's amazing. Anyway, and as I said, very eloquent writer, very easy read because of her writing. And I already mentioned my problem with the word madness and feelings about her preference for manic-depressive rather than bipolar. Let's see. Now here's another thing that I thought about. I think part of her success was because she had so many people looking out for her. Her mother, her brother, her colleagues, her superiors, her peers, and the fact that she was in the psychiatric field, so she had a bunch of psychiatrists around who could help her out as a friend. I mean, she was lucky. Now imagine how many people out there are not that lucky. I know because back when I was in Los Angeles, my early years in Los Angeles, when I was still young, I took public transportation, right? Oh my goodness, so many people that were around that were taking the public transportation, or the homeless people, they were obviously off their meds. Whether they had lost access to the meds or whether they just refused to take the meds and they had no one to make them take it. They had no family, no friends, whatever, and they just lose it. How many? A lot, a lot. A lot of the people out there on the streets, it's a mental illness issue. So yeah. Anyway, and I will reveal to you all that my husband and my younger daughter actually suspected me of having bipolar. See, my younger daughter, she is quite a little genius, but not that kind. She's, as I explained before, the rest of my family here, my immediate family, are on the spectrum. So it's that kind of genius, right? And she was studying the DSM manual, the the whole textbook on mental diseases and whatever. And she was, kind of diagnosing people around her, right? And she wondered if I was bipolar. And both, my husband and she thought that, maybe I am. And I was like, I was like, I'm not bipolar. I'm a Libra. I should make that T-shirt. But and then she told me about the different kinds of bipolar, because the classic one is like her. You have the periods of mania and then periods of depression, periods of mania, periods of depression, and there's others which is quite different. And I think she mentioned something about cyclothymic cycle and things like that. So there's different kinds, and of course this is 20 plus years since she wrote the book, right? And anyway, when I read this book, I was like, huh, I can see why they think I'm bipolar. And it's like, now the jury is still out on it. I see the similarities. I can see why my husband and my daughter thought that I could be. um, and there's enough similarities there, but there's also enough dissimilarity that I wouldn't say that that would be me. But it definitely makes me want to research more. Now the beauty of this book is her not just her honesty in describing her struggle, but also the most important thing, her struggle with staying on medication. Because I'm telling you this, I had to take medication. And I was already a healer. I was already teaching healing at that time. This is the whole reason why I retired after the birth of my child. I was at the peak of my work, I guess you could say that. And then I had my pregnancy, and when you're pregnant, it just changes your body so much. And I was struggling with a medical system that refused to give me a choice. I wanted to have a vaginal birth after C-section, but the doctors, I went to doctor after doctor after doctor after doctor, they all refused. It was because I was on HMO, and there was the medical politics at that time in LA was such that they did not, they did not, they were not on the side of VBACs at all. So anyway, so that led me to have a very, very bad, I had a very good pregnancy, but I had a very bad delivery, very bad. And it led to psychosis. And I'm telling you that I probably should write a book on this, because as healing intuitives or intuitive healers, or healers who have, experience the energy field, how do you distinguish between psychosis and information from the energy field, right? Well, I can't go into it here. You'll have to read my book. Anyway, but so there are a lot of very interesting things. But what really was very difficult, okay, besides the fact that like her, I struggled against medication because I was fine without medication until, that breakdown, which was, because what I faced was really, it was a huge thing, right? And I wanted to have that back, the before the tragedy, I wanted those periods back. Why can't I go back to that? But you know, some things, I mean, I also had cancer, right? I mean, it's like it happens. Things happen and you can't change it. Then you just have to live with it. You do the best that you can. And what was really harmful for me was how many people in the healing community were anti-medication. And yeah, so I know exactly what she talked about when she talked about, her sister dissing her for taking meds. And you know what? And you, Jean, you're talking about trying to figure out who you are. It when I After I had to be on meds for some time, I did come off meds, right? And then other things happened and I had to get back on it. And I'm telling you, and I had just gotten back into healing work again. It was so hard because I judged myself. Am I so weak that I can't do without this thing? And I was thinking, the sensitivity that I have is such crap. The only thing that gave it any sort of meaning was the fact that it helped me to help people. And that's why I was a healer. And to suddenly realize that I couldn't just be myself as I thought, that I had to use a crutch, that I had to use medication, it killed me. I thought, I'm not me anymore. I'm not a healer. What the hell am I? It was so hard. I'm telling you, it was so hard. So yes, like Kay, I fought against it back and forth. My husband had to force me, I was not violent like her, but I had this agitation. I had to pace constantly, couldn't stop. And, people thought that that was a bad thing, but I'm telling you, if the person is not attacking other people or him or herself, let them pace. Why do you have to tie them up? Why do you have to restrain them? But anyway, at one point at the ER, yes, my husband had to restrain me, right? Because I couldn't not pace. And I said to him, I hate you. I hate you. Got me in the emergency room, popped an Ativan. I was normal. Immediately, like seconds. So you just have to understand that we can't be prejudiced when it comes to what works for people. There are so many factors that contribute. Also the environment that they're in. I don't have my family here. All the people around me are very different from me as well. Maybe if I had lived in the Native American reservation that adopted me at one point in my life, would be different. I had people who understood me. I had the nature all around me. Maybe it would have been different. I don't know. But, given what I have access to, it was very wrong for these people in the healing community to diss me, because they should have encouraged, they should have supported me, they should have helped me. And to this day, you still see a lot of literature that is pro this and pro that. Like even Candace Pert, Molecules of Emotion, I respect her work very much. But if you read up on her views about sertraline, she's among those people who think that it is detrimental to a person's health. But I'm telling you, unlike Kay Jamison, who had side effects from lithium, I don't have any side effects. And I know because, being a post-cancer person, I do take other, I take a lot of medication, I tell you. But with the cancer meds, there is definitely side effects. I was off Lupron for like 6 months when my father passed away because I couldn't bring myself to the hospital. Once I got back on Lupron, boom, my back hurts. I feel like an old woman, and my fingers, arthritic and all that stuff. So I know, side effects do affect me, but sertraline does not. Absolutely no side effect whatsoever. When I started taking it, I was like thinking, shit, I'm not going to be me anymore. I have this crutch, the real me is faulty. But guess what? And people warned me, you're going to lose your sensitivity. I'm telling you, no. In fact, my sensitivity is increased. It's better. Why? Because I'm balanced. You see what I'm saying? And how I was able to come to terms with that was watching watching X-Men. Okay, you got Jean Grey, and she's like totally losing it because she's, and it all those years it was Professor X who had, you know, uh taken care of her brain, her powers in such a way to keep her level. Well, sertraline is my Professor X. Because without it, I'll be like the Phoenix, Jean Grey the Phoenix. Who wants that? No. But you see, so what I am very curious about is, yes, where is this whole thing with lithium? Do people still have to take 300 milligrams? Does it have to dull your senses? Because in terms of sertraline, I don't take that much, and it doesn't give me any side effects whatsoever. And it is much, much gentler than, say, Prozac or any of that other stuff. So there you go. So yeah. Let's see. Is there anything else that I need to say about this book? So ask me anything if you want to. Yeah, so the struggle to stay on meds, that pain is real. And my feeling on it, okay, because some people do report about what they call, what do they call it? Sertraline syndrome or something like that, where, you take something like Zoloft or whatever, and then it's you become suicidal and and stuff like that. And it's like, well, maybe it has to do, I mean, the way they prescribe that thing is like, okay, first 25 milligrams and then 50 milligrams and then 75 milligrams, and 75 milligrams is the lowest therapeutic dose, right? Etc. etc. And you know what? I have found that with very sensitive people like me, you can't do that. You have to take even smaller increments with longer intervals. So perhaps those people who, got suicidal, killed themselves or whatever because of an antidepressant like that, maybe it was the dosage. You see what I'm saying? Has anybody considered that? No. And I'm telling you, This has got to stop, this prejudice, okay? Because the allopathic people and the complementary and alternative people, they're not talking. You know, people have these prejudices, and that's not going to help. We've got to talk so that we can figure out something like this. Okay, it's not that antidepressants is all bad. Maybe we need to address the dosage and how it's being administered. You see what I'm saying? And not counting the fact that if we also incorporate energy medicine, you know, in this book, she talks about how the combination of medication and psychotherapy, you have to have that. You have to have both. You can't just do medication alone. You can't just do psychotherapy alone. You have to have both. Well, what I am proposing is that if we can introduce energy medicine, because energy medicine can access those other levels, because the mind is not in the brain. The mind is non-local, right? How do we access those areas? Through the layers, right? How can we do that? Energy medicine, right? So why are we not using it in mental health care? So yeah, so that's my little thing. That's why I'm back in healing touch. Anyway, it took cancer to come right back around and deal with mental health issues. Okay, so the case for okay, so as I was saying about the restraints, unless the person is violent to either themselves or to others, why do you have to restrain somebody who can't control, you know, this erratic need to move, right? Let's see. Okay, I talked about all of that already. And also, important message in the book is untreated mental illness. It's a matter of life and death, you know? And that's what these people need to understand, is that the medication will, you know, keep you from taking your own life. And I've seen this happen. And also, here's another thing is just like the attitudes, okay, of the healing community towards medication. That's one thing. Another really bad thing is how many, okay, how many, yes, go ahead, Jean, see you. I mean, if you need to eat or go. But how many doctors, psychiatrists, and people like that have a secret illness that they have to hide from the world, you know? And then one day you find that they've committed suicide, right? Wouldn't it be great if every you know, supervising you know, whatever, is like the people that that were case superiors. They knew her struggle. They knew she had a good psychiatrist, that she was on medication, all that stuff. And they supported her, you see? And I think that is objectivity, okay? And I'm telling you that objectivity is important. This is the reason why I'm in healing touch, and I'm not just going off and doing intuitive healing work just on its own. I mean, yeah, I do that because that's what I am. But the reason why I support healing touch very much is because of its objectivity. Because you have to learn that. And that is how you can tell what is psychosis and what is the energy field talking to you. Okay, objectivity. And the same thing with these superiors who are you know, in charge of doctors, nurses, you know, psychiatrists or whatever. Objectivity, be objective. Are they doing their work properly, right? You know, so that you can tell if they are on track with their treatments or medication, so that they can still be a doctor or psychiatrist or whatever. So it's not about being someone who has an illness. It's about being someone who is getting, who is able to manage their illness. That's the key, you see? So then we can support people, doctors, and, you know, all these people, they're also human. Why do they have to be like, I don't know, saints or something? But anyway, so there you go. So that's my spiel. And there you go. I think I've covered everything. And it is 11 past the hour. So I guess, does anybody else have anything to say or comment or?
I just thank you. And also for sharing, because that is brave. And just like I kind of wonder when I see it, why is it so different with everyone? How do they find what makes it normal for them? How much do they go through trying different meds and then off of them and then trying them again? And that's why I said she was just like, it reminded me of somebody being on a very high spectrum of autism, being able to articulate and put everything. She was able to do that, and it was very, very impressive. But it's not like that for a lot that I see.
Yes.
So that's the sad part.
Yeah.
So, but thank you.
Yeah. That's the reason why I do what I do, is, thinking about all those people out there who don't have a voice, who can't talk about it, and who don't have people helping them, and who don't have resources. I had a very strong resource deep inside me, my spiritual path. Not for that, I wouldn't be here, and I wouldn't be how I am today. So, but lots of people don't have this, and that's the reason why I'm back in Healing Touch. So that was after the cancer experience and seeing how I sailed through cancer. Because cancer, I'm telling you, as hard as it is nothing compared to the beast of mental illness. And I think I got cancer because in the cancer community, that is where I could get my foot in the door, because it is the most advanced in terms of, funding, and breast cancer in particular, funding and care and research and technology, etc. It just moves so fast. But even in the cancer community, the mental health issue is not being, maybe it's starting to be addressed now because of the 2020 thing. But back when I was, starting to do my mental health advocacy and things like that within the cancer community, that was 2017, 2018. Nobody was talking about stuff like this. Now people are talking about it. But anyway, so yeah, it's, we just chip a little bit at a time. But anyway, thank you for listening to me. And I guess this is it's great that I read this book. Lots of rabbit holes to pursue again with each book. But this book definitely. And I'm writing my own book. I'm writing 3 books actually. So all right, all you wonderful people, thank you very much.